I was made fun of my whole life for having freckles. And now people are hennaing themselves for this. I'm gonna need everyone to make up their mind on freckles. That's all I'm saying. How's that for a segue? There's two different ways that you can have sciatic nerve pain. One is through true sciatica, and the other is through piriformis syndrome. So that's what we're going to talk about today. Okay, what is sciatica? Technically, sciatica is any irritation of the sciatic nerve. What is the sciatic nerve? That's the sciatic nerve. It goes all the way down your legs, into the hamstring calf, down into your feet. So true sciatica is typically caused by a spinal disc impingement in the low spine. An impingement of the sciatic nerve in the spine can be caused by a lot of things, like a herniated disc or a bulging disc. And if you don't know what those are, check out my previous post on Instagram about spinal disc contraindications. And yeah, there's a bunch of other ways that sciatica, true sciatica, can occur. But those are the main ones: herniated and bulging disc. It's basically, again, picture where a disc kind of pushes on that sciatic nerve and causes discomfort and pain. You'll typically feel the pain down into your butt, down into your leg, and down into your foot. So if that is true sciatica, what's piriformis syndrome? Piriformis syndrome is down in the piriformis. What's the piriformis? Great question. There's a group of muscles in your butt. We're going to call them the deep six rotators. The piriformis is one of them. Got it? Good. The sciatic nerve runs behind the piriformis. A lot of people have an overactive piriformis, a very tight piriformis. And what happens there is, think about your piriformis as that manager that likes to micromanage everything you do, and they would honestly rather just do all of the work than release any control over to you. You have this micromanaging muscle, and it's not letting anyone else do any of the work, and it gets overworked. It can spasm, it can get super tight, and that, since the sciatic nerve sits right underneath it, the piriformis, when it spasms or when it gets tight, can push right up against that sciatic nerve. That's piriformis syndrome. So they will feel very similarly. In both cases, you'll get mild to excruciating pain going down the leg, into the butt, maybe even into the back a little bit. It can feel like an electric jolt. It can be like burning pain. It's really, really painful. Anybody that's had a pinched nerve anywhere in their body knows how painful it is. So think about that, but all the way down your leg. Okay, so the real difference between true sciatica and piriformis syndrome is where the nerve is pinched in the body, the spine, or essentially the butt. And that is why sciatica and piriformis syndrome are so hard to diagnose, even for professionals, doctors, physical therapists, because it feels the same. The symptoms are essentially the same. You can test differently to see what feels better and what feels worse, and I'll talk about that in a second. But overall, it's a pinched nerve. It's the same pinched nerve, it's just in a different spot. So that's why it's really hard to diagnose. How to differentiate between the two. If you have true sciatica, it will typically hurt to sit down. Why? Because if you have a herniated or bulging disc, it hurts to round or flex the spine in the direction of the herniation. And typically the herniation or the bulging disc will go toward the body, toward the midline. So if you're rounding the back and you're seated, you're making that disc bulge out even more, and then you're pushing on that, and then the disc that's bulging out will push on that sciatic nerve running down the spinal column, right? So that will explain why that makes that feel worse. It will typically feel better when you stand up because you're decompressing the spine and helping it stretch out. This is not a definitive test. Neither one of the ones I'm going to discuss are. but that is what is typically common. So if you have piriformis syndrome, it's actually the opposite. It feels better to sit down because you're releasing the piriformis muscle. It's not tight and flexed anymore to help hold you up, to help rotate your leg. It is actually in a relaxed state and therefore is no longer pushing on the nerve. Whereas if you stand up, the pain might get worse because you're flexing that muscle to hold you up. So if you're sitting down and the pain lessens or goes away, it's probably piriformis syndrome. If you sit down and it gets worse, the pain is probably originating from the lumbar spine and therefore it's true sciatica. Again, not a definitive test, but it's a good way to try to figure it out. And again, I'm not a doctor, and if you feel pain, you should always go to your doctor. Okay, so another test to see if you have sciatica is you can sit in a chair and let your body slump. Let the whole spine curve. Like just kind of let everything go. Let your core go, let your spine curve, let it flex. And if that hurts, then it's probably sciatica again, because you're increasing the herniation, the bulging of the disc, you're putting more pressure, it's pushing on that nerve. So that's a good test. Okay, if you have piriformis syndrome, you can lay on the ground. I'll just do this. Come with me. Perfect. So if you have piriformis syndrome, a good test is to let one leg go long and pull your other knee up into your chest. Grab that knee with your opposite hand. So this is my right knee, I'm grabbing with my left hand, and then pull that leg up and towards your shoulder. So if you feel a tightness or like a really big sensitivity or any of those sciatic nerve things that we discussed, then chances are you have piriformis syndrome. Do both sides. If you do both sides and one side feels worse, significantly worse than the other, then obviously you have your answer. You probably have piriformis syndrome in one leg. Not a definitive, but that's the test. Okay, so you might be wondering why it's important to even differentiate between the two. And the answer is the treatment that it's gonna take to fix it. A couple of things you can do if it is piriformis syndrome. First, supine figure 4. There's a couple of different ways to get into this. You can just lean back, pop your leg over, and pull your other leg up, like so. Make sure you point or flex the foot and the bent knee just to protect the knee, but that'll help stretch out the outer hip. You can also do that from laying down. The next one, if you do have piriformis syndrome, I'm gonna recommend deer. Parallel the shin to the top of the mat, and then bring your knee behind that heel. It's like you're trying to make a 90-degree angle with your right leg and then a 90-degree angle with your left. You can fold forward, right? That'll help stretch out the back of the hip. In order to help the piriformis relax and all the other deep six muscles relax, you can always take a lacrosse ball, roll that out. The other thing that I would say to do, rather than forcing muscles to relax, is fixing the immediate problem, right? So the immediate problem with piriformis syndrome is that the piriformis is overworking, it's spasming, it's tightened. So you have to encourage the other 5 deep rotator muscles to pick up their slack, to stop letting the piriformis take over and really learn how to use the other muscles in the butt. I'll put a picture here of it again. And it's gonna be really hard to think about, oh, how can I turn those on? How can I make those work? Because our brains have just been like, oh, the piriformis is gonna take care of it all, so I don't even need to activate those other 5 muscles. I'm just gonna let the piriformis do it. So we have to reteach our brain, our neurons, to fire those other 5 muscles. And I'm not gonna go into that in this video. Maybe I'll do a follow-up of how to try to do that. Sorry. If you have true sciatica, we are a little bit more limited because you can't sit down, basically. You can't flex the spine forward, so that eliminates a lot of sitting postures. There's 2 things that you want to do when you have a herniated or a bulging disc. Anything that will help decompress the spine is the first thing that we want to do. The best way to decompress your spine is by hanging from something. Literally find traction. You can grab a pull-up bar, You can put your hands on 2 different chairs and let your low back hang. There's a bunch of different ways to do it. But that's step 1, is to decompress the spine. So what we'll do to help extend the spine, I'm going to point you down at my rug again. I'm going to grab a pillow. So if you have a herniated or a bulging disc, just laying flat might be hard enough for you, right? So you're going to grab a pillow, you're going to place that pillow underneath your belly, so like the opposite side of your low back, so right where your belly button is. Go ahead and lay down there, and then just let your body be heavy. So what you're doing is taking out that curve, but you're not adding, you're trying to just flatten the low back. So you're taking out this, the C curve that really shouldn't be in your spine anyway. The lumbar spine is lordotic, right? It looks like this. That's what that means. So that's what we're just trying to flatten it and extend. So if you're there and that already hurts, try to hold it. First of all, if that hurts, don't do it. Go to a doctor. Second, if it doesn't hurt, but you don't think you can go any farther down, like say remove the pillow, hold it for about a minute, 6 to 8 times per day. Once that feels better, release the pillow and just lay on your belly. Again, 6 to 8 times for about a minute per day. Once that feels good, you'll move into Sphinx pose. So elbows down, forearms down, see how the spine is extended forward. Pull your elbows back, shine your heart forward, look forward. Again, we're adding more curve into the spine, we're adding more extension into the lumbar spine, which will help pull the vertebra apart to help create space in that spine, to help that disc kind of get situated back and release the pressure off the nerve. This is a really weird angle to talk to you at. Hi. Okay, the last one, and this is really, really intense. It's technically seal pose if you're into yin yoga. So if you're in Sphinx and you're like, oh yeah, give me more. Go ahead and push into your hands and gently lift. And you can bring your hands out for a little bit less intensity. And you can bring them in for a little bit more. But what I want you to think about is how much you're really bending into your back rather than pushing into your pelvis. And again, trying to pull your arms backward and send your chest forward. So what you're really trying to do, again, is extend through the spine. Bring the pelvis down and the thoracic, the mid-spine, away from the lumbar spine. All of those, about a minute, 6 to 8 times a day. If you want to go longer, you can. I would say no more than 1 to 3 minutes, 6 to 8 times a day. Okay, last thing I'll say about sciatica. If you have true sciatica, try not to sit. And if you have true sciatica, but you're like, but I have to work my job, I get it. Try not to sit for long periods of time. Force yourself to get up like every 10 minutes. I'm not kidding. If you want downtime, some couch time, watch TV, lay on your couch. Try not to sit. You need to decompress your spine as much as possible and not compress it even more. All that work you would do with the McKenzie method and the decompression work from hanging from your pull-up bar or whatever is all undone when you sit for long periods of time and you're just pushing on that nerve again, and it'll hurt. So, you know, if it hurts, don't do it. Okay, how to prevent this from happening to begin with. It's the same for both. 1, maintain good posture. And I've done a couple of videos on posture, so check those out. 2, avoid sitting for long periods of time. 3, exercise regularly, and before you exercise, stretch so you're not forcing that piriformis to be like, give it some time to release, relax, then work out, and then stretch that shit again. But hopefully that helped. If you can, get vaccinated, wear a mask, spread love, be safe. I'll see you next time. Bye. Can I help you with something?